And in terms of, just to confirm, in terms of capacity, and this is the bit that may take some time. So Teresa is here as acting chief executive. Jane is here. Are you here, Jane, as the acting deputy chief executive or the director of people?
Well, both, but I'm, yeah.
You're split in two?
Yeah.
Okay. And we also have Paula here today in terms of quality and nursing. So is anybody else acting today? Apart from me. Okay, super. Okay, so we can go on to the minutes of the last meeting, which was the 9th of April. We want to go through these minutes, first of all, for corrections and accuracy. We will pick up maximising in terms of the action list. So pages 1 and 2, 3 and 4, 5 and 6, 7 and 8, 9 and 10. Pete?
Yeah, I think it's just presentational, Chair, but the last two paragraphs under the Stunthorpe Steelworks item belong to the Mayoral Combined Authority item. Just thank you.
We just need to shift those final two paragraphs there onto the previous item. Okay, well spotted. 11 and 12. Page 13 and 14. Page 15. So with that shifting of paragraphs to the correct section, are people happy with those as being a true and accurate record of our meeting? Super. So I can sign those. And then if we move on to the matters arising in the form of the action list. So if we kind of go through these. So the first one is completed, which was around the board committee summary reports. And that has been completed. And I think I've mentioned before that as of July, we'll be running the board differently. I think in terms of the style of the agenda, there will be an opportunity for us to receive updates from all of our committees and groups. And also through that process, I think that's intended to connect the board to the work of the wider ICB. Because what strikes me is there is so much stuff going on that the board is not connected to, which becomes really useful when we start to plan for the future. But also, you know, despite the fact that we have significant challenges, there are significant achievements that we have kind of made collectively as a partnership. And I think we need to give equal airspace to recognising, despite the challenges, the significant contributions that we are making. So that will be part of, and we'll be talking to committee chairs and SROs in the next few weeks around what that might look like. So we completed that one. So the next one was committee terms of reference brought to the board for approval in May, June. So we have an item later on this afternoon, the second part of the meeting, which is about the committee structure for the ICB moving forward. And once we've looked at that and considered that, I think that's the point where we'll need to look at terms of reference. There is a risk if we look at terms of reference now, we'll have to look at them again. And much as I love terms of reference, I think doing them twice in 2 meetings is probably not where we need to be on a hot afternoon. And the board assurance framework review, we need to kind of pick that up. That's probably likely to be at July's meeting, where we need to consider the current items on the back. And I think there is something we talked about last time, which was the potential of an item that kind of captures the risks around ICB changes and transition as well. So we will pick that up in July. So are there any other actions that we had from that meeting that we haven't picked up? Okay, super. So the next item is the acting chair update, and I suppose I've kind of covered some of that in my opening in terms of the very difficult and challenging climate in which we're all working at the moment, the balance that we have between delivery at the moment, but also starting to plan for the future, and really the sensitivity I have around this is significant change, particularly for the ICB, and in terms of managing this change is going to be really challenging. But I hope that we are quite optimistic around the longer term outcomes in terms of where ICBs will move as a student commissioner. I think Teresa will give an update about that later on. And then also over the past few weeks, I really valued the time that I spent with most of the people around this table to talk about your thoughts about the ICB, around changes, around transition, and certainly, you know, really benefited from your wisdom around how we need to approach things kind of moving in the future. So thank you for giving me that time. And also, I've been spending time, particularly with our key partners in local authorities, around the opportunities moving forward in terms of the work of this board, the integrated care partnership, but also starting to think about what partnership might look like in the new ICB world. So thank you for indulging me and giving me the time to do that. And I really value your support. It's a challenging time for all of us, but I think there's a massive opportunity here for us to continue to kind of work together. And also the changes that we need to make to how the board and the integrated care partnership kind of operate moving forward are changes which I think you've all said to me are the right things that we need to be doing. So that's probably all I wanted to say in terms of my updates. Oh yes, and of course the other thing I wanted to say was that you will have had an email around the retirement of Stephen Eames. And I think we kind of recognise within that the contribution Stephen has made to the setup of this ICB, the work around the partnership, and probably actually we are where we are now because I think of that leadership in terms of establishing this and really the way of kind of working. So I'm sure you will join me in terms of wishing Stephen all the best for his retirement from the end of this month. Okay, I have that further down the agenda. So it's all right now. I'm flexible and okay, Teresa, over to you.
Okay, thank you. Can you put the slides up for me, please? Thank you. So there's a couple of things I want to take us through. Most importantly, of course, around the model ICB. But then coming to my executive colleagues to support me during both this and then on both performance and finance, given that there are no formal papers in the public part of the board on that, both of those topics, wanted to make sure that there was an update in public. So if we just test that this is working, yay, great. So we'll start first with the model ICB. So what I'm going to take you through, I know we discussed it at the board last time, but this now is obviously post submission, and there's a bit more information that we're sharing with you in terms of where we are up to. So a quick recap: we received the blueprint on the 6th of May, and we made a submission as required on the 30th of May. So that submission was both on time and in keeping with the financial envelope required of us. We have had some feedback to date, which has been positive as far as it goes. And we've also had a check and challenge meeting with Region. So what we're doing is continuing to iterate our proposals as we trade things and work with our colleagues across other ICBs, always, of course, with an eye on the function that we need to deliver in the future and the financial envelope that we need to work within. So the most important thing to say is that the future ICB is still work in accordance with our system strategy, which is, of course, our partnership strategy, and that's really important to us. So we're still going to deliver in terms of that strategy, and that guides what we want to do. So this is what we set in terms of our aim in the work that we have progressed. So to deliver a model for the future as that strategic commissioner, but delivering on the ambition of our strategy within the new cost envelope. I'll come to Anya in a slide or two, but I just want to underline the engagement work that has taken place as part of these proposals. A rapid pace of work that has actually given us real dividends, I think, in terms of the proposals, the engagement that we have had with staff, from staff, should I say, has been significant, And I'm very grateful to everybody who's given up many hours to actually support our development of this. So, Anya, do you want to talk to this? So I'm coming to Anya because Anya has done a sterling job of leading the approach to this.
Yeah, thanks, Teresa. Happy to do so. I think you saw this slide last time, but this just pulls together really the plan on the page in terms of the work that has been happening. So you can see on the left-hand side really what we called the group, the design group, had been doing to the point of submission. So defining the new purpose, designing the new proposed operating model, shaping and supporting the workforce, and managing the risks. And you can just see the activity that's presented there. As Teresa touched on, although the timescale was incredibly tight to get this in, I think we had 19 working days to develop and submit the proposal. We did really try as much as possible to engage our colleagues, both our senior leadership team colleagues and our wider colleague base, to share with them the outline model and to then capture their feedback, their thoughts around that, which did go into the final submission on the 30th of May. To cover this piece as well. So, this outlines really the proposed model on the left, and you can see here, the model for RICB in the context of the likely direction for our system. And we've heard a lot about the accountable care organisations, and we believe that we will move into that arrangement, but that is obviously yet to be determined on the right. But we could see a situation where that evolves into those two geographic footprints around York and North Yorkshire and the Humber. But if I stick to the right, our model is based on some of the work that we'd already been doing actually around developing a really agile organisation. So we've got these four interdependent and interrelated business units around the core function of being a strategic commissioner. And then you can see in the orange blocks the commissioning pathways in essence. And the idea is all of those business units, the resource in those units would support the delivery of obviously those commissioning pathways and being the core commissioning function. So that's how the model is set up. And I think it's really important to stress, because you've possibly seen some of the coverage, particularly in some of the sector press. But while there was a template to complete, each ICB has gone about it in a slightly different way. We very much interpreted the model ICB guidance and started then from a blank sheet of paper. So ours is a proposed new model. It's not just cutting from our existing model. So it goes back to Teresa's point around as much as possible, albeit I'll stress again with that limited financial envelope for the future. It has been challenging, but as much as possible to design a model that can deliver around the ambition of our strategy. Thanks, James.
So obviously, whilst there is an urgency to the work that we are doing to establish the model ICB, we recognise that there is going to be a period of time of transition, and we've set out there what we'll be doing for the rest of this year and next year, which will be around embedding the core business. And part of you'll see the later slide, I'll talk about some of our transition costs. We have identified costs associated with the transition because we are really, really clear that setting down on a piece of paper how things should work doesn't necessarily mean that that's how they're going to work. So our transition costs recognises that we will need, for example, really good HR infrastructure and support to deliver the changes to the new structure within the model ICB, but we'll then also need really good OD support to make sure that we've got an organisation functioning with the interconnectivity that we genuinely need to see and is actually really important to our operating model into the future. So this is where we get to the transition committee. So NHS England advised that everybody should establish a transition committee, which we have done. Jason is the chair of that committee, and we have now met twice. And whilst the terms of reference that we should get everybody to look at in a second say that the meeting will be on at least a monthly basis. At the moment, we are meeting fortnightly to make sure that we can keep pace with the change of work that we need to do. Is there anything you want to add on the transition committee, or should we just approve those minutes?
I think if we just go to the terms of reference, I think very much this is overseeing the plan for transition. I think as part of this, we have also asked for a specific risk register around transition, which I think may help us then think about what everybody needs to put on the board assurance framework around transition and the risk to be sit around it. And we've agreed that Jane will be our transition lead organisationally, so kind of leading that piece of work. And we've identified a number of key priority work streams that we need to kind of pull together. And I think that committee is not only looking at the design of the organisation, but also in terms of people, but also starting to think about, most importantly, the transfer of functions, which I think are on that earlier slide, aren't they? They talk about the need to transfer functions, but I think the key words are safe and appropriate. So we need to have a really clear plan for how we transfer, or if we transfer kind of functions around it. So I mean, I don't know if you wanted to go to the terms of reference, which are helpfully in part 2 of your pack. So you may need to. Are they in part 2?
They're in part 2 of your pack, yeah.
So I'll give you a second to flick to part 2 of your pack to find the terms of reference for the transition committee. And the transition committee, of course, will report into the board on a regular basis. That you have an assurance that the work is kind of being undertaken. It's a relatively small committee. Has everybody found those terms of reference? Yes.
That's what page was. It's all in one pack.
So
255 pages to make.
Do you know the page in which they're at?
I think it came out as a separate document. There's a document that deals with 7B for part 2, which is called Transition Committee Terms of Reference. A standalone document.
Yes.
Document.
Yeah, document 7B.
That on a separate email.
Yes. If you can't see a copy, maybe the person next to you has a copy in front of them. Yeah. Remember the committee, Mark?
Yeah, I know. I gotta say, I've read it. I know.
You've seen them at least 3 times.
Yes.
There's an assurance there.
You know what's in them.
We're good.
Emma's got a spare copy if anybody is really struggling. Would anybody like to see Emma's spare copy? Okay, so can we approve those terms of reference? Terms of reference are only ever a point in time. If there are any future amendments, they will kind of come back. And as Teresa says, it says in there that the committee will meet monthly, but decides to meet fortnightly because the pace of this change is kind of so rapid. And we will do an update at each of our ICB boards in terms of the progress. So you have assurance around the work committee and any issues that are arising and risks, and we will share the risks with you to determine the back. People are happy with those terms of reference?
Yeah.
Thank you. I segue into this.
Yes, absolutely. So we will, as Jason said, be looking also at the functions to transfer. I'm not necessarily going to go through this in any detail. We've got a list there. I can't possibly read that list from here. But it's important, excuse me, it's important that the board understands the level of analysis that we're doing for each of the functions that may possibly transfer. And I think, whether it was the last board or the board before, we talked about being really clear about some of the assumptions that we were making, because of course we're still working in the absence of the totality of the information that we will have at a future point in time. So we are really clear about documenting those assumptions so that they can be tested out over time and changed if necessary. I think we are clear that the main functions that are identified for future transfer are in keeping with those suggested by NHS England in terms of services such as safeguarding, IPC, CHC, children's continuing care, for example. And the points to note that clearly until legislation changes, even when we transfer those services, we retain the accountability for them. So in the short term, until legislation changes, there would still need to be additional resource within the ICB to ensure we have that accountability oversight.
Any questions? We've got any questions around what you've heard so far or transfer of functions? We will revisit this in part 2 as well. But I think it's just the headline in terms of the key issues that we are managing at the moment. And I suppose before we go to Jane, I mean, just to really reiterate, this is a significant kind of piece of work across the organisation. And I think, you know, where we've got to is a testament to, across the organisation, the commitment of staff to kind of move us forward with this and to be quite honest and realistic around managing kind of a difficult process. So I think, you know, we are in a strong position, but it has been, not to underestimate the amount of work that's got involved, we've gone into kind of getting us to where we are. Jamie, you're going to pick up the people element of this, which is significant.
Yeah, well, specifically the employment hub. I think I spoke at a previous board about the development of the employment hub and then the launch of that employment hub. And I think it was imminently about to launch last time that we spoke, and it has launched. So I've got 2 or 3 slides really just to talk you through what we've done and what do we mean by the hub. And this was developed in-house by predominantly the people team, but lots of other people have contributed to it to enable us to provide in the moment support for people for things that might become incredibly important to them. So pensions advice, for example, financial planning advice, careers advice, and the ability to connect into different workshops to enable them to do that. So it is up and running. It's hosted on our internal portal. And there's 3 main areas really that we're focused on around the support for it. So you can see on here that we're going to offer transactional HR support and process and advice. That launches once the process has gone live. So we don't have that part live yet. We've got all the career part live and the ability for people to see where jobs are and connect into jobs, but not that part, which would include things like clearinghouse arrangements. So how do you connect into the vacancies that are around? And we're working across the system on that because, of course, it isn't just the ICB where they've got changes that are going to impact people, and therefore we've got a commitment to supporting people in the best way we can across the system, not just in our ICB. We've also got organisational change support, process and advice, and wraparound support for colleagues through and beyond the transition. Important to say that in our weekly staff briefings, we also have a commitment to answering every question that's raised. And so far, we've got a bank now, I think, of about 300 questions, Anya, I think it is. And a lot of the questions that we're now getting, we've already had some of the answers to, so people can access those as well. And we issue those by the end of every week. So every week there's more and fresh questions that are coming through. Go to the next slide, please. I know this is a little bit difficult to see, but this is just a screenshot of our employment hub so that you can actually see on here. There's a your wellbeing section, a your finances section, your skills section. So people being able to connect into new development, to develop new skills. We're getting really, really good feedback from it. So there's 6 sections and we do ongoing promotion in there. So we feature it in every ICB check-in. We feature it in every staff briefing. It's in every newsletter, and we give a fortnightly update on our hub news. So a dedicated newsletter just for the hub. And we have a feedback loop, which allows people to tell us what they want to see, new things, different things. And really interestingly, a lot of our partners, way outside of our system even, are sending us things to put on the hub, and others are starting to copy what we've got on the hub. And then last slide, just to see some of the hub highlights. So our hub has got 34 sessions on it at the moment, for example, that colleagues can book onto to help them. We've got collaboration with wider partners, and we've got a featured jobs section, and we've got an automatic feed from NHS jobs into the hub so people can see it. Of course, we have jobs broader than NHS jobs as well. So we're getting really good feedback from our people on it. When we have our staff briefings, a lot of support for this hub, and the ability that people have in their own time to be able to access it and get the information. So it'll be something we keep building and are happy to share anywhere that people may want to see it.
Any questions around any of that? Yeah, before we've got Alison, then we've got Paula. Alison.
Yeah, so we have jobs in the BCSE. So is there a way we can feed that into this hub?
Yeah, there absolutely is. Yeah,
Just let me know how we do
I'll
that.
connect with you, Alison, and then we can feed them in. Yeah, that's brilliant. Thank you.
That would be really helpful. It's really good. And of course, we've got all 6 places. We might want to coordinate that. I've stayed at the 6 places. Paula.
Thanks, Chair. So just a comment really, in terms of how valuable my team found. I mean, we can weekly and we'll talk through the issues, and obviously there are some concerns around that, but the feedback around the hub is phenomenal. Yeah, it's really good in terms of how supported they feel, the breadth of things they can access, and it's been universally well received, very well received. That's lovely to hear. I'll pass that on. Thank you.
Brilliant. Okay. And then we'll revisit some more detail around this in part 2 of the meeting. So if you have a question that you're thinking about now, you can ask it later. So Teresa, moving on to performance.
Sure. Yeah.
I'm sure you're going to pick one up.
Indeed, yeah, that's all right, Chair. Yeah. So,
You're not now because we've taken it off the screen.
yeah,
You missed your moment, though.
fleeting as it was, yeah. Thank you. So we'll start with your favourite subject, Chair.
Which is
UEC.
UEC, or is this ambulances?
No, it is ambulances, but your favourite subject is UEC.
UEC is my obsession at the moment.
Once we get the slides back. Yeah. No one else can see them, can they? So, yeah. So, I'll try and fill in a little bit in the absence of the slides.
And we're
So-
working to find the slides.
This is just a
Here we
headline
are.
snapshot of the position. There's more detail in the more detailed monthly report further on in part 2 later. But in headline terms on UEC, this has been as colleagues will be aware, a challenging area for us for some time. There are 3 key areas that we're asked to focus on in 25-26. Ambulance handover delays, 12-hour waits in department, and the 4-hour standard. So I'll just quickly move on to this first slide. And this is, I think, a reflection of the tremendous amount of work that's gone in the last 12 months, where from May 2024 to May 2025, ICB for Humber North Yorkshire is the most improved out of 42 ICBs in terms of progress on the capital response times and the work on our ways and others to improve that. So we were, by way of illustration, 32nd out of 42 in September 24, and as of the month ending May 25, we're now moved to the dizzy heights of 9th in the league table out of 42. So clearly we had a high starting point, but nevertheless progressed quite substantially in that time. And you can see we're some way away at the next one behind us, top of that table. So huge thank you and tremendous amount of acknowledgement to our ambulance providers, our acute providers, and others that have contributed towards this collective position. And certainly the work done on W45 since December has been instrumental in that space. This slide summarises the bottom right there shows the league table as of May, to illustrate what I've described. And we've got the 4-hour metrics on the left, 12 hours in department on the top right, and the Cat 2 position for our 2 ambulance providers on the bottom left there. I think there is some green shoots in relation to our 4-hour position. Harrogate have exceeded their plan for the first 2 months of this financial year. York have hit that plan for May and showed an improvement from where they were previously. And certainly in 12 hours in department, which has been a challenge for us and is a key indicator of our patient safety and quality, that's showing signs of improvement as well. So hopefully the continued upward trend in this area will sustain over the next few months, and you can have a much more productive conversation with your favourite subject with the regional director on strategies.
Will do indeed.
Okay, on elective cancer and diagnostics just briefly before we move on to other aspects. Just to say that our cancer 62-day position is going in the wrong direction, and there are a number of reasons for that, and that's particularly focused at two of our four main providers. There is a lot of work going on to try and improve that position, but that's dipped in the wrong direction since March. And then on diagnostics, likewise, that's gone in the wrong direction. There's a multitude of reasons for that. We're trying to unpick some of the detail. Underutilisation of our community diagnostic centres is one of a number of factors in that space. And then on the next slide, please, Teresa, on elective, in headline terms, our total waiting list is coming down, and that's ahead of our plan. Our 52-week wait position, again, is coming down ahead of our plan. 65-week waits, we had a plan to get to zero by the end of quarter one, which was a legacy of last financial year. We're not going to get to zero, but we're not the only one that's unlikely to do so. We've got a couple of 17-week waiters as referenced at the bottom there. And then on 18 weeks, we are currently ahead of plan. And you can see top right there where that applies to our respective providers. York and Harrogate are ahead of plan so far, although we don't want them to get too excited in that space because that's going to cost us extra money that we can't afford. So just a balanced position there before Des points that out. That's all to have on the performance for now, Chair, but we'll come back to the detail later.
Okay, we'll look at the detail kind of later on. So some positive information there about green shoots. The ambulance kind of situation, I think, is something that we need to note and kind of note the achievement around that as well. I think that's a real testament as to how can we actually kind of solve a problem, a system problem with a system solution. And I kind of think there's something to be recognised there as well. I think green shoots, but we are relatively early in the year, aren't we? So there is, and we have winter yet to come, and winter will still remain with the ICB. So
it's a gift.
It's a gift. I was told it was a gift. We were being gifted winter, which is interesting. So, but we will have a chance to interrogate that, and I suppose to ask some of the questions around some of those areas that are causing us concern today, as part of part two's conversation. So, financial position. Over to you, Des.
Thank you. So I will keep this brief. For those of you that were in the meeting last month, you'll remember that we were showing an adverse variance in month one of £2.6 million, and that has improved significantly in month two, largely due to a fortuitous gain in one of our providers. So two providers were still adverse variance, but at a reducing run rates of deterioration. So an improvement in the sense itself, but we had fortuitous gain to offset the state adverse variance, and so we're posting a small variance of 163k, which turns up as 0.0% on our returns and isn't statistically going to cause us any difficulties at this point. We do need to keep an eye on the ongoing run rate, though, because that was a very non-recurrent in a month, as say, fortuitous gain, which won't be repeated. So we're keeping sort of a very close eye on how the run rates are moving going forward. We have had an overspend in pay in the month, about 2.7%, but ongoing issues with supernumerary staff and sickness cost pressures in some of our providers, being offset at the moment by some non-pay savings. But again, we will need to keep an eye on that and check that the run rates are coming back in line with where we're expecting. In terms of our efficiency delivery, we're 8 million pounds behind plan at the moment, but we have got plans in place to mitigate that. We had a planned condition at the start of the year to have 0% unidentified by the end of month two. We've come very close. We cleared 45 million pounds of the gap, but we've still got a small 12 million pound residual gap to close. And again, based on the improvement that we've had, region are not flagging any significant concerns. So we've reduced from 19% unidentified to 5%. So a significant improvement. And we're still working on reducing the level of high risk schemes, but we've also seen an improvement of that from 46% high risk to 35% high risk. since planning submission, so a £31 million improvement there as well. So it's all moving in the right direction, just not quite at the pace we were expecting. And then the final bit just to touch on is around unmitigated risk, and this isn't just the efficiency risk, this will be total risk within all portfolios. So in our plan, we had an unmitigated risk of 90 million. As of month 2, we're now reporting 79 million. So we've had a £10 million improvement in the round across providers, some ups, some downs. And so again, that's moving in the right direction, but obviously we still got a big chunky number to clear, but it's month 2 and we still very much keeping the focus on how we clear those trajectories and the ongoing conversations around how we bring those numbers down.
Thanks, so green shoots, but early days.
Very early days, yes, and new risks emerging as people move through the process.
It's good to see that improvement from the concern we had last month to the position now. I think that's significant. To see that going in the right way.
It is, and whilst we've got absolute targets, I think the assurance region is taking is that the quantum of movement that we're showing is significant. We're not moving slowly, but it's in terms of our efficiency program at any rate. But yes, they'll keep monitoring that.
Super. And we'll pick up some of that in part 2 as well. Any questions for Des or for Sean on what you've heard? Okay. Do you have anything else?
No, nothing else unless there's anything anybody wants to.
Okay, so we're going to move to Michelle. You're going to give us the update now, which is the intensive and assertive community mental health treatment review. So over to you. There's a paper in the pack, and we'll work on some people have read it. So this is the overview, and for anybody kind of presenting, I think in presenting the stuff, if at the end of that you can tell us what you want the board to do with it, that would be really helpful because we can then report that as the actions and make sure that we follow those through. So over to you, Michelle.
Yes, thanks, Chair. Apologies, I was a little bit late. This is the composite report, and I thank Lynette Robinson, who's done all the work on it. As the Chair said, you have read it. This is following the tragedies that occurred in Nottingham with the Velcalocaine incidents, and this is about intensive and assertive mental health treatment. We have done a detailed review, actually, of all the provider organisations' response to the current information that has come out. So we're still waiting for the final publication of the independent report, but they did make several recommendations. So we've had quite a lengthy conversation with each of the providers in detail. I can reassure the board, as it says here, but there has been assurance to prove this, that all of the action plans have been submitted to the relevant provider boards and agreed and signed off by those provider boards, which is obviously what the ICB is interested in. I won't take you through them all. Hopefully you can understand the process that we're in. We have identified some gaps in the process that we are working through, and they're contained in the action plan. I've got detailed action plans on all these from all the organisations, and the Mental Health Partnership Collaborative will be taking an overview in respect of all those action plans. As indeed, obviously, will the respective boards. It is slightly complicated with Ardash, because Ardash were originally going to submit all their data to South Yorkshire, but we have said that it must include the elements in relationship to this ICB, so they are included in the action plan. So the main gaps are as in the orange segment. That doesn't mean that there are massive gaps. That just means that we haven't received the absolute, and we've been really stringent in relationship to it, given the severity of the incident. So the one about family engagement, I'll draw your attention to item 5. Clinical information sharing, which is always up there. I think we're getting more interoperable systems, but as you know, we do struggle in relationship to data collection, but we are doing that more coordinated now with the systems that we have in place. So I can see that should be a lot more streamlined. Cross-organisational working, this is one, and we're no different to other ICBs in relation to have checked the action plan. In fact, we're further forward on a lot of things, and we probably have assessed the providers a little bit higher in some areas. I think I'll leave it there. I mean, there is some issues in relationship to resources, which I won't go into today, because obviously the providers have identified that if they're going to continue to do some of this, there may be extra resource, but working to see what we can do within the current budgets in relationship to resource mobilisation, as it were. So the main things are the family engagement, the clinical information sharing, cross-working, that peer support and the joint clinical decision making. But it is there and I'm happy to answer any questions.
Thank you, Michelle. That's really helpful and really kind of comprehensive and a really kind of high quality paper, I think, that tells everything we need to know. And I think it's probably quite honest in terms of the level of assessments to each of the areas. So we've got Teresa and then we've got Stuart.
So very quick from me. Firstly, just to echo, I think Lynette needs to know is I think it's a really good report and what could be quite complex given the recommendations, etc., set out really clearly. So I'm very grateful for that. Is the plan that this will then, because it was going